both sides, ladies. Don't worry. So he's in a seated position, and I need him to be kept in this seated position. Okay? The CT is here, right? And if you notice, I'm going to have to get my body slightly up on this, okay, because of the fixedness of the table. CT's here, and I'm just going to contact against it and have a little bit of a push. So I stabilise the TT to start with, and I stabilise this body position. From here, I'm just going to rotate his head that way. I start off by just bringing him into rotation. That's it. This hand now, I don't want to smother his beautiful face. Yeah, I'm not going to smother your beautiful
rotation
face.
Not to the end, right?
No, never, ever, ever go to end range. At no point do we ever, ever go to end range. We always find it and then back it off. So when we come into the upper cervical complex, the OAAA, we take the head to end range and then we back it off 50%. Because at end range, what do you stress?
Ligaments.
Yeah, what do we not stress with this? Ligaments. We don't stress ligaments. So I lock it in, I bring him just into where the barrier feels. So I bring him to where the joint does this. Springs back to me. Springs back to me. Now from here, I look where the face is, this is my hand, and I want to protect the head. So I will come in and I will lock underneath the suboccipital ridge. From here, I put his temporalis in my chest, like that. You notice you can still see okay. I'm not going to thrust. Now from this position, I now have to take him back to the barrier, which is here, and I might have to add a little bit of flexion, maybe a bit of side bending. I've got to take him through a few little micro movements. You can feel that? There. So that is the barrier. That's off. He'll breathe in. As he breathes out, I take him back to it, and then I do a rotation past it. Yeah? So on this side, I come up and I lock the patient. C7-T1 is here. My thumb, yeah, she's thinking, oh shit, I think I should have done that. Trust me, this technique is easier than trying to do this. Honestly, this is easier. So my thumb locks in here and I just stabilize. Bring the head to the point where it just wants to push back, which is there. Yeah? Yes. From here, I stabilize the scapula and I just lock underneath the ridge. So I just come in and I lock underneath the ridge. My elbow is a little bit high because I want to protect this. From here, my chest just pushes forwards, and I now, if you notice, I'm going to close my eyes because I want to start to feel where that sort of feedback is on that lock. Okay, that's the lock. I back it off. Breathes in. As he breathes out, I go back to it and past it. And it's a rotational movement. I am stabilizing with one hand, see, told you, and I'm going